everyone, this is Sangeeta Gopi from MedCity International Academy, and I'm here with another OET speaking video. Today we are going to do a video on home visit. I've noticed that we do have regular viewers and subscribers to our video, so thanks to all of them who are quite regular in following our videos. I've also noticed that we have fresh viewers coming up now and then. That's very much encouraging as well. When I went through a couple of the videos that I had done previously, these are the two names that I've noticed. So my apologies to any name that I've forgotten and I've not taken. There are two of our viewers, one Vaibhav Bhagwat and the other Eva Cherian. Both of them have requested for an OET speaking on home visit. So today that's exactly what we will be dealing with. So now you will see how Anse, the nurse, deals with our patient Ashok. It's a home visit and she's here to teach Ashok how to administer insulin injection. So have a look at the video.
Hi, good morning. I'm Ashok, one of the OET trainers at MedCity International Academy. I'll be taking as interlocutor's role, and here with me is Anse, one of our students. She'll be taking nurse's role. So Anse, here is your role play card and a pencil. So you have 3 minutes time to prepare for your role play. You can start preparing.
Good morning.
Good morning.
I am Anse, one of the registered staff nurses who is working in the community health center. Am I talking to Mr. Alex?
Yes.
Okay, Mr. Alex, your GP had sent me to explain you regarding the self-administration of insulin injection.
Alright, please get in.
Okay, thank you, Alex. Do you have any idea regarding self-administration of insulin injection?
No, I'm really confused. Last time when I went for a checkup, so doctor has told me I may need to self-administer insulin injections. He told that my oral medication seems to be not working properly. So that's why he told me. So I'm really confused how to administer these injections.
I can explain you regarding the administration of medications. And are you following a good diet, and do you think anything that worsens your blood sugar level or elevates your blood sugar level?
I don't know, but for the last years I've been on diabetic medications as well as diet, and even I'm performing exercises.
Okay. So that it indicates that you have developed a medication resistance. That means in some cases some patients prolonged use of medications will cause some medication resistance. In such cases doctor will go for a option like administration of insulin. Okay, so that it is highly recommended that now you should follow the insulin injections.
Alright. So I don't think so I can manage myself because I'm really scared of getting injections.
Yeah, okay, I really understand your concerns, but I can explain you in a comfortable way how to take this in yourself.
Alright.
Okay, shall I, or do you have any other concerns?
Is it not possible for you to speak to the doctor to increase the dosage of oral medications?
As I told already, your insulin level or your blood sugar level is not controllable with the current medications what you are taking. Even if increasing the medication, it won't be effective.
Alright.
So the doctor had told to start with the insulin injections.
Alright.
Okay.
Yes, you can proceed.
Okay. First of all, while before administering the insulin injections, you have to check the insulin needles. You have to see that it is sterile and not contaminated with any infection. And that can prevent a possibility of infections. Okay. And when coming to the administration of injection, you have to, you can load the insulin in an accurate and correct dosage which your doctor had prescribed, and you can go for the 45-degree of insulin injection. You can administer insulin injection in a 45-degree angle.
All right.
Okay, you can go for 3 sides for insulin administration. One is the upper arms and the thigh and the abdominal area.
All
in the
right.
abdominal area around the umbilical cord. Okay.
Oh, there seems to be a lot of confusion. Is there any other alternative other than these injections?
As I told that.
Because like as I told you, I'm really scared of the needles. So
Yeah,
is there
that
any other alternatives you could provide for me?
Because you may have confusions or this because of you are administering the insulin injection as the first time.
All right.
I can ensure you that you can manage this situation well, because I have seen many patients who are managing well and controlling their blood sugar level well with administration of insulin injection self. Okay, so that I can give you a leaflet which will make you to go through that, which will make you to know more regarding your self administration of insulin injection.
All right.
Okay.
Let me see whether I can manage it or not, because
Yeah, okay. we will
I
see.
need some assistance for taking injections. I don't think so I can manage myself.
Okay, do you have any family members who can assist you in?
Right now no one is there at home.
Okay, so that I can arrange somebody from the community health center for initially or for first 1-2 times they will help you in administering insulin injection, so that gradually you will learn how to and I can assure you that you will be more comfortable while administering the insulin injections self rather than administering others.
Yeah,
okay,
fine. That's the end of your role play. Thank you.
So that was the 5 minutes of Anse's performance. Like I said, it's a home visit, that's a setting, and she's here to teach the patient on how to administer insulin injection. A quick remark that I would like to give Anse on her performance is she's done it quite well, but I would say the area that she needs to improve on is grammar, definitely. If you look at her speaking, throughout I would say her grammatical control is quite weak. But an interesting fact is, this weak construction of sentences mainly does not hinder the communication much. What I'm trying to say is, though her sentence construction is not very effective grammatically, whatever she's trying to convey is quite effectively done. So the information that she's trying to pass to the patient is quite clear, but definitely Anse, an area that you can improve is on your grammatical aspect. Other than that, if you look at her speaking, I would say there are positive and negative sides to it. So let me begin dissecting the speaking further. Let's start with how she began the conversation. Now this setting is quite different from most of the other settings, where it is a hospital ward, an ICU, or any other hospital, maybe a children's hospital or a general ward that a nurse talks to a patient in. Now this one is a home visit. So how do you begin your conversation when you're visiting a patient at that patient's home? Now how Anse began is quite good, I would say. She first introduced herself and then she asked, "Am I talking to Mr. Alex?" Now that's a good way to start, because she's checking whether she's talking to the right patient, the right person. Like I said, if it's a hospital setting, a hospital ward or an ICU, you know a particular patient is assigned to a particular bed. Okay, so probably there is no need to check on a patient's name every time. You can also check the patient's medical reports that are there along with the patient to clarify who he or she is. But I would also say it's hospital policy to check whether you're talking to the right patient, even if the patient is in bed in a hospital. But here, when it's a home visit, you have to make definitely sure whether you're talking to the right person, because in a person's home, there could be many other family members. So if you're not sure whether you're talking to the right person, there is no point in wasting time talking to the patient's mother or father when you're not able to get across your information to the patient. So I would say that's a very good way of checking whether you're talking to the right person. So she started off quite well. But then she went on to say that your GP has asked me to come and talk to you. Now, using the word GP will not be very good in a conversation that you have with a patient. Now, GP I would say is a term, a very colloquial term when you look at the medical field or scenario. Now, GP is nothing else but general practitioner. But if you use the term GP to a very normal person, right, a very random person, he may not necessarily understand what a GP means. That may further confuse the patient. So it's better to keep it as simple as possible. She could have just said, your doctor. Or she could have, pulled it out and said, your general practitioner, if she really wanted to use that word. It would have also been much better if she could have used the doctor's name. Okay. For example, she could have said, your general practitioner, Mr. Roy. Any name of a doctor. Or she could have checked, is Roy your doctor? That would have been a very good way. So please avoid using such terms like GP. Okay. Any other medical terms or words that are quite familiar in a medical field should be avoided when talking to a patient. You can use this word if you're talking to a doctor or a nurse or any other medical practitioner, but kindly avoid such terms when talking to a patient or the patient's carer. Another good aspect of her speaking is that she was listening to the patient, because at times when the patient spoke, she used words like okay, Now these fillers are really good. I remember reading one comment from one of our viewers checking whether using words like okay, are these good in speaking. I would definitely say they are very good to use, because that's how we normally respond in a very normal conversation. Even if you're talking to a friend, if you're talking to a relative, if you're talking to, let's say, your officer, you're talking to a patient, when you listen to somebody, you would definitely use these fillers like okay, This is to show that you're intently listening to the patient. Now remember, your OET speaking is not evaluated by the interlocutor. Interlocutor is the person you are speaking to who takes up the role of the patient or the carer. Now your speaking score is given by 2 individual examiners. So how do they score you when they're not actually present for your speaking? It's quite simple. They listen to your audio recording. And when the examiners listen to your audio recording, it's very good to use these fillers like okay, I see. Now when you use these fillers, you're conveying the message to the examiner that you are listening to the patient closely. You're paying attention to what the patient says. So I would say it's very good to use such fillers, but again sparingly. Don't overdo it. So I would say good that she was listening to the patient, and another positive aspect of her speaking is she was checking what the patient already knew about his medical condition. So that is taking the patient's perspective into consideration, which is another requirement of your OET speaking. Because she checked with the patient, she asked Alex the following question. She asked him, are you following a good diet? Anything that elevates your blood sugar level? Like she said, have you noticed anything that elevates your blood sugar level? Now these are good questions to ask the patient so that we have an idea of how much the patient already knows about his condition and what are the patient's perspective or take on his condition. And following that, she continues the conversation and she responds to it by giving him relevant explanation. So when he said yes, he's been taking his medicines regularly and he doesn't understand why he requires an insulin injection, she was able to give a good explanation saying, okay, there are chances or there are scenarios when the patient starts developing a resistance towards medication. Your case could be one such, which is why your doctor has asked you to take insulin injections. She was able to give this clarification only because she first took the patient's perspective. She listened to what he already knew, what his idea or understanding about the condition is, and then when he asked a question, she was able to respond to it. So these are good things. Giving information, taking information, looking at the patient's perspective, these are all very much required and are the marking criteria in your OET speaking. Probably another area that Anse could have improved or worked on is paraphrasing effectively. She asked Alex, do you have any idea of self-administration of injection? Now, self-administration of injection is a word that is given in the roll card. I'm sure we'll never talk to a patient like that. I mean, self-administration of injection, that sounds really weird. It sounds more like a written language. So what she could have done is, though it is given in the roll card, you can try and paraphrase it effectively, making it into a more spoken form. For example, she could have asked him, do you have any idea on how to inject insulin on your own? Do you know how to use an insulin injection? Do you know how to inject yourself with insulin? These are simpler ways of asking the same question. So try to avoid using the same words given in the roll card. Instead, if you paraphrase it effectively and use more normal spoken form, it shows the examiner that you are able to converse more effectively using layman language and also talk in a more natural context, which is what happens in a hospital. So this is one suggestion I have for Anse here. Another good aspect of her speaking is, if you've noticed, when she started explaining about the usage of insulin injections, she made sure that she was clearly listing out her instructions. What I've noticed many students do is they give bulk information. They talk a lot, especially when instructions are given or information is given on how to use certain medicine or an ointment, or maybe even cleaning your wound or dressing your wound. There are many steps to it, and mostly what students do is they give these information in a bulk. It becomes very difficult for anyone listening to an instruction to make a note of every point. So it becomes very important to list out your instructions. That's one requirement. Another is, it's good to signpost. Signpost is nothing else but to give a short, it's like giving a subheading, what you're going to say next. So you simply say what the next thing that you're going to explain about. About listing, Anse said, first of all, check the needle. Now this term first of all is what I mean by listing out. So she's given a very good order or a serial in which she's giving out the instructions. First of all, next, after that, later, you should also. Now these are good ways in which you can list out the instructions. She also used signposting where she said, when coming to administration of the injection. So this is signposting because she's clearly mentioned what she's going to describe, right? So it's clear that now she's going to talk about how the insulin injection need to be administered. So these are good things that you can use in a speaking. It becomes much more easier for the patient to memorize the instructions given by the nurse. So I would say, Anse, good job on that. But I have another suggestion for Anse. For all of you out there, whenever it's a home visit, whenever you're trying to explain or demonstrate something to a patient, you can use this particular tactic. Now the idea here is to give a real demonstration and be more descriptive. For example, in this particular scenario, Anse was describing on how the patient can use an insulin injection. Now, one good way to make your conversation effective is to really enact your role play. That's exactly what the OET speaking is all about. It's a role play. That means you have to act out your role. So imagine you're talking to a real patient. You're visiting the patient in that patient's home. Would you talk to the patient by folding your hands? Just by using, words? No. We will use gestures. We will use our hands. We will have facial expressions. Use all of these even when you have your OET speaking. That will help make your speaking very, very natural, and you will easily be able to have a very smooth conversation. So my tip here is, when Anse has to explain how an insulin injection needs to be used, she could have demonstrated it. For example, she could show a pen that she has, or anything that she has on her table, and she'll say, for example, you say, see, this is the insulin pen that I would like to introduce to you. If you can see, it has two parts. There's the main pen and there's a lid to it. When you take off the lid, you can see that this is the part where you mount the needle, where you insert the needle. You can also see that there is a refillable place where you can refill insulin once the syringe finishes. If you look at the bottom of the pen, you can see a window here, and it shows how much insulin is left in the pen. You can also see there's a knob at the bottom, and turning that, there's a dial with the numbers which will show the dosage of insulin. So this is how she could have demonstrated, look at this, see this part in red, this part in blue, the knob at the bottom. She could have also explained about how to give an air shot. When you give an injection, she can say that first you need to press a little so that the insulin comes out of the needle. This is to ensure that none of the air bubbles are present on the needle before you insert it. So demonstrating it would have been a very effective way of talking to a patient. Another area where she could have demonstrated is when she spoke about the areas where the insulin injection could be administered. Now when she speaks about the umbilical cord, she can actually show her tummy, saying, okay, this area, a big smiley area below your umbilical cord or below your belly button is where you need to administer. If it's the arm, you can show your arm and say, this area on your arm, the upper area, the outer area, or your thigh, the outer area of your thigh. So try to enact it. That will bring a lot of difference to the way you speak. So this is a tip that I have. So whenever you have any such scenarios, try to enact it out and see if there's a difference in your speaking. I'm sure that will bring a huge difference to the way you actually conduct yourself in a conversation. Another suggestion, and I would say this is one of the last suggestions that I have to give Anse, is she has to try and convince the patient. Now if you remember, Alex said, is there any other alternative? You see, I'm really scared of needles. But Anse didn't take this into consideration. She just said that, I'm sure you're feeling this because it's the first time. You'll feel more comfortable when you keep using it. She has to try and convince the patient here. Now he's clearly mentioned what his fear is. He's scared of needles, that's it. And administering insulin injections involves a needle. So how can she convince the patient of using an injection? Probably she could have addressed the same concern, and she could have probably given examples of how an insulin injection needle is very different from a normal needle. We all know that the insulin injection needle is not that very long, and it need not be inserted too deep into the skin and all such things. So how would that prick feel? Is it going to be very painful? Would it just feel like an ant biting? So try to convince the patient of how much pain he would have to suffer when injecting the injection or insulin into his the fatty area or his skin. So that would have been a good way to convince the patient. So if a patient conveys his or her fear, try to convince and clear any aspects about his fear first, and then go on further to trying to put your point very clear that you need to have this insulin injection. So this is my last suggestion to Anse. So I hope these comments and feedback will help Anse and all of you out there who watched this video. I'm sure you've had your own comments and suggestions in your mind when you're watching this. See if it has matched what I've given. I'm sure there would be further comments and suggestions on this. If you find anything else, you're all free to put it on as comments. Thanks for watching and hope this video really helps out all of you there.